keeping an eye on imaging. Discussion and commentary based on articles from JACC, Cardiovascular Imaging.
Welcome, ladies and gentlemen. My name is Stefan Achenbach. I'm here with Dr. Jörg Hausleiter of the German Heart Center in Munich, who has a paper in JACC Cardiovascular Imaging with the title A Reduced Tube Voltage of 100 kV for Coronary CT Angiography, Impact on Image Quality and Radiation Dose. And with Dr. Jim Min of Cornell University, New York, who wrote an editorial on the paper. Jörg, can you please tell us what you examined in this study of yours?
Yes, Stefan, coronary CT angiography has been criticized about the radiation dose associated with the methodology. And what we were looking at in the Protection 1 trial was the overall radiation dose of cardiac CT and how we can lower the dose. And what we found is that one strategy to reduce the dose is lowering the tube voltage. And in this particular study, we addressed the issue if the image quality is being maintained with this new reduced dose scan method.
So I would imagine that if you change the tube voltage, something happens to the images. Does it impair image quality, or what were the results of your study?
Well, what we found is that while lowering the dose very significantly, approximately between 30 to 50%, the image quality is being maintained when you look at the image quality in terms of image quality scoring each vessel, how well you can display the lumen, the stenosis, and the plaque.
So obviously, Dr. Min, there's a way in which radiation exposure can be reduced. What does this mean for the field of cardiovascular CT and especially coronary CT angiography?
Yeah, I think that this was a large step forward for the field of cardiac CT. Historically, traditional methods of acquiring images with cardiac CT used non-negligible doses of radiation, and I think what Dr. Hausleiter demonstrated was that using 100 kV tube voltage, we can substantially reduce the radiation without impairing image quality. I think it was a great study.
Is that something that can be done in any patient? Is it only for selected patients? And are there maybe even other ways in which radiation dose can be reduced for coronary CTA?
Well, the lowered tube voltage is first, as I said, is very attractive to because, as I said, it maintained image quality, but it's not really usable for everybody, but for the majority of people. We would scan patients with a body mass index, for example, below 30 with this methodology.
So is that something that you apply in everyday use also?
We apply that in everyday use. And when we go back to the Protection 1 data, and looking at how many patients had a BMI below 30, then we saw that this methodology would qualify for more than 80% of patients. So it's really usable for a large majority of patients, but not for everybody.
So what kind of radiation doses are we speaking about? What were the doses that you found in your study, using the old method and using the new method of 100 kV?
With the old method, we're talking about the dose approximately around 12 to 40 millisieverts. And with the reduced tube voltage, we're coming down to dose somewhere between 6 and 8 millisieverts on average.
And Jim, you know that there are other ways in which you can also manipulate the amount of exposure in coronary CTA. Do you think we can realistically go down even further? And is this something that we should strive for in every patient to have the dose as low as possible? Or is it just special patients where we should really try to keep the dose down?
Yeah, I think that what this study demonstrated was the feasibility of one particular radiation dose reduction technique. There are numerous ones out there. I think that there are at least 4 or 5 other things that you could do to reduce radiation to very, very low doses, much less than the annual background radiation of somebody just living at sea level. I don't think that should be the major goal. It depends on the patient, and it's not a one-size-fits-all, but that we individualize the image acquisition parameters to optimize diagnostic image quality for each and every patient.
Okay, thank you very much, gentlemen, and thank you very much, ladies and gentlemen, for your attention.
Have a question or comment about a CVN story? Send us an email at cvnfeedback@acc.org.